Well, hello everyone. It's Candace, Al, and the BAMs from the Nspire U Network. And as promised, we have some very prominent city and state leaders with us this evening. We want to thank them so much for sharing their time with us. We have Representative Barbara Drummond from District 103, Representative Napoleon Bracey from District 98, and City Councilman C.J. Small from District 3. How are you all doing this evening?
We're fine. How are you?
Doing good, doing good. So basically, we're just going to go through, ask a few questions. There's so many concerns with the current pandemic. Information is changing daily. People don't really know what to expect. So we just want to kind of help them out with some of those questions. I'm going to throw it over to Al, and we're just going to jump right in. Al?
Representative Drummond, this first question is for you. What avenues offering assistance to constituents in your area are being affected financially by this COVID-19 outbreak we have?
Well, that's a great question, and one that I am so honored to answer, because it's not just Representative Drummond, but our local legislative delegation, as well as the Alabama delegation. We held a week ago today, we held our first webinar with small businesses to sort of outline what the stimulus package would hold for them and what opportunities could be availed to them. And on that following day, we held one for nonprofits and also for faith-based community. And I am proud to say that we reached over 300 participants in both of those webinars. We've also held one for those that we find in our community who are unemployed right now. And we have been helping them to sort of maneuver through the process. And we were told on last evening by our Secretary of Labor for the state of Alabama that we are one of the few states where our folks who are unemployed are now getting those compensations right now. So we've been holding a number of webinars to educate our folks on the process of how to get those stimulus dollars, because they're there. And as a matter of fact, on last evening, talked to someone in Doug Jones' office, because as you know, the president is getting ready to sign the second part of the stimulus bill. And we put some provisions in there that we thought were handicapped to our folks on the first one, particularly that as it deals with banks. You know, what happened on the first pot of money, those who had relationships with banks, those are the ones that they looked out first for. But those folks who were small businesses, they were left out in the cold. So those are one of the things that we've tried to fix in this next piece of legislation. So we've been doing a whole lot of education as it relates to those benefits for those persons that are in our community.
Quick follow-up, Representative Drummond, you talked about the faith-based community. We know that's huge in the Black community. What specific things might churches need to do or kind of prepare themselves to get some funding, get some help?
Well, under the payroll lending part of the stimulus bill, churches have an opportunity, because churches have staffs too. We know that many of our churches have schools and they have daycare centers, and they've had to either lay off or to furlough their employees. Well, those employees are entitled to receive unemployment compensation. In addition to that, those 501Cs for the church, as well as that particular school or business, they can go and apply for the PPP loan program. So there's a pot of money that they could apply for. And what we have been encouraging them to do on our webinar, we actually had someone from the Alabama Bankers Association talking to our ministers, as well as somebody from A&M. And the most important piece was the Small Business Administration. I was happy this morning when I was listening to MSNBC, when there are others who were talking about there's got to be a way for the government to front this money instead of us using just the banks, because that was a big hindrance. So churches can apply for those funds as well. And there was one particular part in the stimulus package that churches can apply for up to $10,000. It says a loan on the application, but that's actually a forgivable amount. And 75% of that money, if you award it, will have to go to payroll. Churches have people who are on their payrolls as well. So those monies, they can access those monies to help with their payroll.
Got it. Okay. Well, Representative Drummond, this question is also going to target to you because it ties into what you were speaking on, but this one kind of talks about the stimulus that citizens have received. So rumors are abounding that the state is going to tax the residents for the stimulus money that they receive when they file their taxes next year. Can you give us some enlightenment there? Is there any truth to that?
Well, I think Representative Bracy can chime in on this as well, but we understand that that may happen. But we have one of our colleagues out of Baldwin County who is going to draft a bill, and I'm sure that a number of us will support that bill, that won't happen because, and I'm only speaking for Barbara Drummond now, I don't think that is wise to do that, especially in these unprecedented times, for people to be taxed on monies that they're using to get themselves back on track. So that's something that we will have to fix legislatively, and I'm sure that myself, along with other colleagues, would be willing to do that.
Representative Bracy, would you like to add anything to that?
I agree with her 100%. Of course, we can't control what the federal government does, but we can control what happens here in the state. We've heard mention of a possible bill to make sure that the tax money was not, the stimulus money was not taxed throughout the state, and also to make sure that the $600 extra that people are receiving for unemployment is not taxed statewide, through the state as well, because people don't realize it, but that $600 extra per week in unemployment will be taxed federally. So they're asking people to try to put at least 10% of that money to the side because they will have to pay federal income tax on that.
Speaking of taxes and unemployment, Representative Bracy, last year the legislature approved the reduction of unemployment compensation to 14 weeks. We got record-breaking unemployment numbers in the state. Do you think when the state goes back into session, will you guys entertain maybe bringing some of those weeks back, seeing we don't know when this may possibly end?
I think it'll definitely be something to look at. Of course, in emergency situations, things change because just like in a pandemic or emergency like what we have right now, you see people are able to maneuver around current unemployment laws, and they're able to relax different things. One of the things being relaxed is called the good clause. With that being relaxed, it allows more people to get on unemployment that traditionally wouldn't. And a lot of people are able to get unemployment based off of the COVID pandemic. But just to be totally honest with you, I did not support, and we didn't support the change and reduction in the weeks for unemployment. And I think the current leadership with the Republican Party in the state of Alabama don't really have the appetite of expanding that. So do I see that being something in the near future to happen? It definitely can be something that's talked about and discussed, but I just don't see that being in their appetite to really take that as something that they really want to push this year.
Can I add to something that he just said? Because I agree with everything he said, but your viewers need to note that we have a super majority in Montgomery, meaning the Republicans dominate both houses. So with that being said, I think that not only did Representative Bracy, but when you look at the entire Democratic caucus and Black caucuses, we all voted against that measure to reduce that from 26 weeks to 20 weeks because we thought it was counterproductive, not only to poor people, but also to the working man. And this pandemic has pointed that was very short-sighted to do. But Alabama was one of the few states that did. And so I just wanted to make that notation.
Thank you. Okay, so this next question is about unemployment, and Representative Drummond, you pretty much answered this because there were concerns that people were saying they were hearing that people in other states were getting their unemployment, but Alabama seems to have been behind or slow. But you did earlier state that those employment claims are starting to be answered, so we appreciate that.
Well, let me go ahead and just note, because on a conference call with the governor this past Monday, Fitzgerald Washington, who is the Secretary of the Department of Labor for the state of Alabama, they were pretty much overwhelmed because this is something that took everybody by surprise. But folks in Alabama unemployed are now receiving those benefits. And they've also hired some more, contracted out to hire some more folks to help get more and more people online. And they also have employed a new tool that you can go on their website and track your particular application. Isn't that correct, Representative Bracy?
Yes, you're exactly right. Alabama is really, people just don't realize in a pandemic, everybody think things are supposed to continue to operate like they normally do. And it just doesn't happen that way. And I know a lot of people have been upset saying, well, I haven't received my benefits yet. I've been calling. The line is busy. I can't get through to anybody. Well, guess what? It's busy because everybody's calling. We've had 240% increase in unemployment in the state. I mean, we've processed in 4 weeks double the amount of claims we processed the entire year last year. So that's how massive this is, and a lot of people are just kind of being impatient about it. And I understand because the need is there. But when I look at what's happening in our neighboring states, a lot of them are far, far behind us when it comes to making sure that our unemployed are taken care of at this time. And with the extra $600 stimulus from the federal government, Alabama was one of the first 5 states to actually get that paid out to the unemployed. So we're on the front line leading the charge with that.
Okay. And please note that if you do not get your application in time, the amount is retroactive according to Secretary Fitzgerald. So this money will go all the way to the end of July.
That's good.
So even if you don't get you miss a few weeks, it's retroactive, which means that they will pay those monies that were missed.
Yeah, and it's and you know how, like, when you look at the thing that's going on right now with the small business loans and things like that, where they ran out of money and now they're trying to do other legislation. One of the things that we're proud of here in this state is we don't have a prediction of running out of unemployment funds. So all the people that file for unemployment should receive their due amount in their unemployment compensation.
Great. I think that's going to put some relief in for a lot of people.
Oh, absolutely.
Okay, so the next question is for Councilman Small, and we want to talk about this from a business standpoint. So, you're directly affected by the outbreak as a business owner. How has this changed the way that you're operating your business?
Well, actually, it has changed a lot. First of all, thank you for inviting me onto the show.
Absolutely.
I'm happy to be here. It has changed a lot, and many families is experiencing something totally different, something that has never really been imagined before, or could it ever been imagined. Having only 10 people can attend a funeral service.
Right.
And basically the 10 people includes the funeral directors, the funeral attendants, and the preacher. It's traditional that our culture, we have a celebration of life. We honor the loved one. We have families and friends travel from Washington State all the way from Florida to the homegoing celebration. Now we can't do that. Basically we know that we cannot congregate no more than 10 in a setting. And so when Big Mama, as we sometimes would call our grandmother or mother, etc., she passed away and she leaves behind 12 kids, it's come to a point as which one of the ones are going to attend Big Mama funeral. And that's just so hard to do. Basically, we know that we're supposed to stay 6 feet away from people. And basically, when you're seeing a mother cry over her child, and you have to stay your 6 feet because you don't know exactly what that mother has, because 30% of the people that carry this virus do not even know they have it. And so I can have the virus and don't know I have it, and I can come to you and we can just start talking, and I sneeze or I shake your hand after I sneeze on my hand and give you the virus. I'm not sick, physically, or, but you turn around, you get sick physically, you have to go to the hospital, federal. Yesterday in city council meeting, Dr. Oxford has spoke to us that this virus is really going to change society all the way around. He said that he was talking to a pastor, and he was saying that whenever we decide to go back to church, you're still going to have to keep that 6 feet minimum. And the reason that is because you could be singing in a choir and the person that's right behind you can be singing too and can have droplet spray coming out their mouth as they're singing and can travel up to the next person which they're behind. And it's just going to change our society a lot. Basically, I had a conversation, with my staff, basically, for them to make sure that they wear their mask. Because again, when that person is grieving, we don't know what they are carrying. And also the droplet spray out of their mouth or their nose can travel. And so therefore, we'll put my staff in harm's way. And then they take around and take it to their families. So we actually had to take precautions all the way around.
Right. And Representative Drummond, and we were talking about that before we got started, as far as society being changed, we're down south, we hug when we greet, when we see each other, that we greet. And that has changed forever. I mean, our lives are not going to go back to the way that they used to be. And it's sad, but we have to be careful. We have to be, take those precautions to make sure that we're keeping ourselves safe and the people that we come in contact with.
Well, it's almost as though we have been thrust into the future, because I don't know about you guys, I'm maybe a little bit older than most, but I remember watching the Jetsons and everything was automated, including communication. And that's what we're seeing today is the way that we communicate and the way that we show outward affection. All of that has changed. I mean, especially because Councilman Small talked about Big Mama. I'm one of Big Mama's children, and she would always tell us to, love is what love does, and when love does something, you embrace, you hug, you kiss, and all of that is going to be gone away. I am a writer by profession. I love the written word. I love communicating with people face to face. That is all going to change. Tomorrow will not look the way yesterday looked. And we all have got to embrace this new culture because it's coronavirus today, but you don't know what else is coming down the pipeline health-wise. Whoever would have thought public health would be dictating our lives? It's almost as though the life that we know has been put on hold because we're all waiting to see what tomorrow is going to hold.
Right.
And another thing too that Dr. Aisha was, speaking of at city council meeting, as even for going back to the church, not only in the choir, but when Sister Hazel, Sister Johnson catch the Holy Ghost and get happy, we can't because again that droplet spray that just go around. So it's sad, but I was joking. I said many times we go to apostolic churches and they got the white sheets and they run up and try to cover the ladies' legs. Now, therefore, we're going to have to try to cover up their mouths, because not just to protect them, but to protect yourself, So it really going to change the way of life from the religious standpoint to even just being at home.
Let me just say, I'm a Christian, and I believe in my heart that God is going to be victorious in all of this. And we're going to get a vaccine that's going to cure us. And I really believe in my heart that this too is going to pass. Now, I hate to get religious on everybody, but I think that God has a way of getting our attention, and He has our attention. So I am looking to a bright tomorrow. I think that it has exposed us to technology, something that none of us were comfortable with. I now have to this is my 4th webinar today. So we all are learning new things for tomorrow. And when you look at our young people who are coming behind us, y'all, they have computer minds. I mean, I have a 4-year-old granddaughter who told me she's going to set up a family Zoom for us to communicate with on Sunday. And I'm sitting up there saying, you know how to do that? And sure she does, because she has her own tablet and she has a laptop that she is now doing distancing learning with. So I am encouraged that God is for Sister so-and-so, when she gets happy and the Holy Ghost hits her, God's going to have a cure for all of what is ailing us. That's my faith and that's my belief.
I stand with you on that, Representative Drummond. You know, and I think it's just, I believe that there's going to be a cure to come. It's just in the meantime, we just need to remain vigilant. So thank you both for sharing that very important information. I think everybody needed to hear that because they don't think about the little things that we have to be mindful of. So thank you again for sharing that.
Awesome. All right, Representative Bracy. Now, there are numbers not matching up. TV stations have different numbers. Social media has different numbers. How exactly are these numbers calculated and how are they reported, or are they calculated, or how does that work as far as the numbers of who has been found to be positive of COVID-19 as well as those who have unfortunately succumbed to COVID-19?
Okay. I think you're going to start to see things match up a little bit better this week. The CDC as well as the Alabama Department of Public Health is been trying to work together on some things in conjunction also with the Mobile County Health Department, because it's been a lot of big disparities in this. A lot of times you'll see deaths reported, and then you'll see deaths from illness, and people are wondering, well, what exactly is this? Well, from speaking with Dr. Harris, the director of the Alabama Department of Public Health, at some point those numbers should get together and just about match. So you have to go through some type of medical procedure, which is not necessarily an autopsy, but they will go through a process to determine the cause of death. And that's why one of those numbers continue to lag behind, because, okay, let's say if a person was in the hospital, we know that they had COVID, they passed away, we're going to go ahead and report that number. But until officially the doctor says this is where we are with this person, they're in that other column, and that column start to catch up. If you start looking at some of the things I post on Facebook, like even today, the number in that second column is starting to catch up because it was just really too far behind, and it was very, very confusing to a lot of people.
Right.
I believe that first number is the number. However, you have some people that may be trying to suppress numbers. You know, you have some people, even for instance, with the Alabama Department of Corrections, we had a prisoner that died this week that tested positive for COVID. Well, they said that the prisoner died from end-stage liver failure. Well, to me, a lot of times people do these things to try to suppress the numbers because nobody really want to have that COVID death on their hands. You know, so the prison system don't want to say, okay, one of our inmates died from COVID. But then my question would be, well, if they had end-stage liver failure, why didn't they have a medical furlough? Why were they not at home with their family resting in their last days in the first place, if that's the case? So I think you start to see that in a lot of places, and I wouldn't be surprised if part of that suppression would be a part of people want to reopen the government as well. They don't want all of these numbers out there that's discouraging people. They want it to seem like it's probably not as serious as it is. And I think that's why you see people like us go out and tell our people, even if they open the government back up, we have to use our good common sense and figure out what's best for us and our families, and not be guinea pigs for them when it comes to this, because some of this stuff we just don't believe. You know, we believe is more COVID deaths than what they're reporting. We believe a lot of people have the illness that hadn't had access to health care. A lot of people don't know how to go about getting the test. A lot of people don't even know where the free testing sites are that they can go to at this point. So we talked with the health department today to try to make sure that that information gets out. If a person gets sick and they don't have insurance and they die at home, they're never tested. They've never been in the system, so they're never tested. And before you know it, they'll end up over there with CJ. CJ won't know. You know, they'll end up having a service. Now the person is being buried, and they never even have any idea whatever happened to that person. So it's a real breakdown. Also with the coroners, somebody should be testing everybody that died at this point. And that's one of the things that we've been asking for, so we can have true numbers and not just the people that die in the hospital or under the care of some medical professional.
Okay. That's a
I like
great
to comment.
segue into, I'm sorry, go ahead.
Yeah, I like to comment. I do agree with everything that Representative Bracy has stated. Truthfully, I don't think that we will ever get the true numbers. As Representative Bracy said, there are two numbers, and those two numbers actually just came out about 3 weeks ago. And I called Dr. Aisho about a month ago, and when the county, was only reporting 2 deaths by COVID-19. And I said, Dr. Aisha, I said, this is not right. I said, we have here at the funeral home more than what you're reporting on television. I said, matter of fact, there's a neighborhood, a certain neighborhood that has COVID-19 deaths in it. And those neighbors, they know, and they talk among each other. Mm-hmm. And so he said, we cannot say that it was COVID until it gets certified by death certificate. And so once it gets certified by a death certificate, and the doctor signs off on it, as Representative Bracy has stated, then we can say it's COVID. So therefore, that's when they came out with the two numbers, with the illness and then with the confirmed. Mm-hmm. And again, sometimes it takes 2 weeks to get a death certificate. And another reason I stated that we'll never have the actual numbers, because remember in the beginning, we didn't have no tests. Most time when people was going to the hospital, and they had some of the symptoms, but they had all of the symptoms, and maybe like they didn't have the breathing problems. They were just sent home saying, just go home and quarantine for 14 days. This is what you need to do with just a piece of paper, and they went home. Those people are not confirmed. Right. When you look at the numbers, it say, or televisions or any other document, it say confirmed numbers. Those people that just were sent home, especially in the beginning, that had never been tested, they are not in those numbers at all.
Mm-hmm. Can I piggyback on that? And I agree with both of them. In addition, I don't think we'll ever get to the numbers because we're just now highlighting nursing homes. Those were cases that were not included initially, but now they're looking at those. And if you look at the national trend, there was a story that is out today that they are citing COVID cases that have gone all the way back to the early February. And nobody was counting those. So, I don't think nationally nor locally will we ever get to a true number. We're pushing as hard as we can to get to as close of a number as we can get to. And Representative Bracy talked about access to health care. That is one of the reasons why it is hitting the minority community so hard, that a number of those deaths are coming from our community. And that's why it troubles us when people in our community don't think that they're impacted. They are impacted more than any other race of people. And it also speaks to, we don't have living. And when you look into many of the minority communities, there are food deserts everywhere where you're not getting those healthy foods to be able to make those healthy choices. And so when we talked about tomorrow, that's one of the things that I think that we have got to begin looking at, is living a better lifestyle of eating healthy foods. When you look at Big Mama, who Councilman Small talked about, she taught us how to cook with, I tell folks, I was raised with every part of the pig that it is, and I like it, but you cannot overindulge in that because it's not healthy for you anymore. So we've got to start a healthy lifestyle in the minority community.
Okay, so this is a perfect segue into the next phase of this, because we want to talk about how to prepare for the reopening, of the state and the city. So right before we started, I heard on the news that Mobile leads the state in the cases and in the number of deaths. So now with this information that you've just given us, we all know that the numbers that are reported are probably higher than they are. That's alarming. So, and I would like for all three of you to kind of chime in on this, and we'll start with Councilman Small. What are your concerns when the city begins to reopen?
My concerns is now, and probably my concerns will be tomorrow, is that many of our citizens, especially African Americans, is not taking it seriously. If you go around the neighborhood, you're still seeing people having block parties. You're still seeing people on Facebook having, a party at home, a child's birthday party. And again, people are not realizing that 30% of the people that's carrying this virus do not even know they're carrying it. And therefore, if I'm picking up a fork and I sneeze in my hand and pass you a fork, and you pick up that same fork, and you got it. I mean, and a lot of people is not carrying it. It's not really just being serious with the situation and really just being knowledgeable. Before we open up the city, we have to educate our people. We have to educate them of, one, how very serious it is, two, to make sure that they wash their hands, three, to keep their hands away from their mouth and their nose and their eyes, and four, really just, to stay our distance away from each other, at least a minimum of 6 feet. Until our people really just get educated and to make sure they're doing everything to keep from catching the virus, I don't think our city is ready to open, because I feel like if the barbershops open, the restaurants go back and open, et cetera, the virus going to expand. Go to McDonald's. I went to a McDonald's yesterday, and the individual took my money. I could have sneezed in my hand, and I could have had the virus and gave her the money, and she turned back around and gave me a food. I turned around and I left, because I'm like, I don't know what you have, who went before me, who gave you money before me. Only thing I know, somebody could have been quarantined and gave you, $5 in ones and 3/4, turn back around and gave me that same money, and then also you touching the bag of my food. And a lot of our fast food restaurants are still, they're not educated. They not seem like it's not serious enough. Basically, I stopped going to, said I was going to stop going to fast food restaurants. And, because again, my health is important, and I'm not trying to bring nothing back to my mother or my staff or anybody else that I love, at all. So until we get educated everyone, the city is not ready to open.
Speaking of reopening, state representatives, either of you can answer that. It's kind of a reopening, but you all have been on somewhat of a hiatus or a leave, because this is typically legislative session time. I know you're preparing to go back to reconvene. What are some concerns you have as state representatives traveling from Mobile to Montgomery when it's time to reconvene to get back into legislative session?
I'll go first, or you want to go first, Representative?
Ladies first.
Ladies first.
Okay. Well, found out today I'm on a Ways and Means Education Committee, and found out from my chair today, because I've been asking a lot of questions about our kids, but found out today they're actually going to try to have us back on May 4th. Again, I don't want us to go back then, even though we've got to do the people's business, unless we are measured and when I say measured, I'm not talking about business. This is one of those times that we have to let scientific facts guide the decision as to when we open, and that includes for legislators as well, because that's a great impact. I don't know if anybody's ever been in the State House. Thousands of people go through that State House on a daily basis. And not only will that harm those policymakers, but it will also harm those persons who come through there. So I was really, really happy. I watched the governor's press conference. We have a conference call with her as legislators every Monday, and she had a press conference on yesterday. And I was happy for her to say that she will not be driven by a date, but she will be driven by the data. And I think that's the same thing for both houses. Our leadership is meeting tomorrow, as I understand, and they're going to be looking at that. But as a policymaker, my health is just as important as an individual. So in our state, there are no ones that are bigger or better. If this state opens up, certainly I hope that we will do it based upon data and not just looking at a date. There are certain things that we have to do legislatively and constitutionally, and particularly to pass 2 budgets. That's very important. But guys, we still need to be healthy in order to do both of those.
Yeah, and I just like to add something real quick to that. We've been advised from the health officer to not ride in the cars with each other. And if that's something that they're telling us, then it's definitely something that's very serious. When you look at legislative session, you have 140 people that represent both houses of the legislature, and those people are from every corner of the state of Alabama. And you put them all into this one pot together, and then when they dismiss, they go back to every corner. Now, if you're talking about the easiest way to infect the entire state of Alabama, let's go back to legislative session too fast, and I think that would definitely be the easiest way. They wouldn't tell us to not ride in the cars with each other if it's still wasn't serious. As far as the state opening back up in the city and things like that, I think it's going to be a layered approach. If you notice, every time that the governor came out with her proclamations, she added a little bit more to it. And that's how the state is going to have to, it's not going to be like a light switch approach. It's going to have to be taking those layers back off. It's going to have to say, okay, where this business can operate, this can operate, people can start doing more of these things, and then you have to have some guidelines in place to let those things happen. I don't think you'll go to a barbershop or a beauty salon again in a long time without the people inside of it actually wearing masks. It's going to be some things driven by public health that's going to make sure that the health and safety of the community is taken care of. Because the one thing that we don't want is a relapse. We can get out here too fast, and this sickness can take over, and it can be a lot worse than what we're currently dealing with right now by moving too fast. So people know a lot of times I'm a critic of the governor, right? So we're going to be honest and open about that. But guess what? I think she made the right call yesterday by saying, hey, less than 1% of our state's population has been tested. We have to drive this by data and not by dates. And, she got a lot of pushback for it, but I think that was really the right move for her to make.
And let me just piggyback. We need to take personal responsibility. Things have changed. They're no longer the same way, and that means that we've got to govern a little bit different. I mean, we've been having Zoom and call meetings and so forth, but we've got to take personal responsibility for ourselves, meaning every citizen has to be cognitive of those things that they need to do to help flatten Alabama's curve. Testing is an issue right now, and I think it's an issue nationwide. We only have 1% here in Alabama, and we look at Mobile, which is Representative Bracy calls it the Mardi Gras melting pot, and that's what we are. And we're seeing our numbers go up because we're just now getting much more aggressive with testing now.
Amber, I think you had a question.
Yeah, I did. I had a question I wanted to ask. So there are things that we've seen where they say if you don't abide by the rules, you'll either get fined $500, which we saw that happen to a business here in Mobile, or you could do time in jail. What is the exact, how do they handle that exactly? Is that if you're not in by curfew, you are fined or you go to jail, or does it just go for businesses? Exactly how does that law work?
I can only speak to the order, the state health order, which is $500. We just had somebody in Andalusia, Alabama, who was throwing one of those birthday parties for her son. And there were almost, they said, 50 to 75 folks there. And then she coughed on the officer when they tried to shut her down. So they not only arrested her, that did not stick, but she's also going to be fined the $500. And that's the violation of the state health officer.
Yeah. Is there any penalty for not abiding by the curfew as well, or is that just for the large gatherings?
But basically, within the Mobile, the first time you get fined is $100, and the second one in additional is $200. So there was some debate about making it higher, but we had to realize that this is a bad time for people, especially paying bills, So that's why the council has set it, $100 for the first time, but the second time is $200. Basically, me personally, I think it should be much higher because, again, after 10 o'clock at night, what you're doing out, especially now things that you don't have no business doing. Mm-hmm. And the reason why there really is a curfew, people saying, well, what the curfew is really going to do? They're actually, also to deter people from, breaking in and crime. If somebody walking the street, in the middle of the night, the officer have every right to go by and say, hey, where you going? You don't have an essential job. We need to talk to you, see exactly what's going on. But we still, at this time, as people, being unemployed, not receiving unemployment checks, stuff like that, crime is probably going to start seeking up high.
Mm-hmm. And just a little bit about the state order. It's up to a $500 fine, and it's a misdemeanor. So it's not like it's something that'll be a felony crime that'll be on a person's record. It's not like the state is trying to be overly strict about this, but we do have to have some parameters in place to say these are the rules, and we have to kind of play by these rules. We have no intent of putting people in jail. Jails and prisons are just as vulnerable of populations as the nursing homes, right? So we don't want to put people in those situations. We just want to create an atmosphere where people will say, you know what, I think it's probably better for me to just do the right thing and just kind of avoid this all the way around.
Mm-hmm. All right. So before we wrap, is there anything else that either of you would like to share with our viewers before we go?
I think that I want to just really reiterate personal responsibility. Representative Bracy, myself, and Senator Figures, and Representative Adeline Clark, and Sam Jones, Representative Sam Jones, we've been pushing PSAs because we see that this disease is a large number of the folks that are in the minority community are either dying or contracting the disease. We are hoping that our folks in the minority community, as well as throughout the entire county, will take responsibility and make sure that they social distance, that they wash their hands, and then most of all, if you need to just shelter in place, do that. But we want them to be not only socially but personally responsible, because this is a disease that will affect everybody. Sometimes you will unknowingly affect somebody. So it's incumbent upon us to take some responsibility for ourselves so that we can see tomorrow. This is something that has gotten our attention, and now we need to be responsible. I told my grandson the other day that it's something that we should have already been doing, and that's being clean. So that's what I want to, we need to hammer that away, that they need to take personal responsibility for themselves.
I'd like to add something. It just makes me so upset when I think about what happened Easter weekend between Municipal Park, Highway 45, people partying from Tomerville to the interstate. Then you start to see it in other areas in Pensacola. It's just that social responsibility is just not there. And what people don't realize is you may be young enough to fight this off. You could very well be one of those people like Councilman Small talked about and be one of the 30% that don't even have symptoms. But you may very well take this to your children. You may take it to your grandmother. The first thing that my wife said, my wife's a registered nurse. And the first thing that she said was she worked with COVID patients. And she was like, when she saw that video, she was like, you know what? I'll probably be taking care of some of their grandmother next week. Mm-hmm. This is so serious, and people are not understanding it. They treat it as if it's a game. People used to make jokes and say, oh, Black people can't get it. We had all these things going around on Facebook, and as soon as Black people started to kind of get a little bit more serious about it, now the state want to open up. It's like, dude, we never had a chance to quarantine. So it's a big deal for us because the numbers. I look at these numbers and I crunch them, and the African American community has just been hit so hard, especially here in Mobile County. We're dying 2-1 in Mobile County. Last week, we represented 66% of the deaths. 66%. And, this is so real for us. And especially African American males. We are dying behind this disease, and people are not taking it serious. The news don't even report the deaths anymore. You know, it's kind of like that first one, you get that first one in Mobile, that second one, you get that first one in Baldwin County, and before you know it, we at 39 and nobody's talking about it.
Mm-hmm.
You know, at what point do we pay more attention to this and start looking at this and say, man, 60% or better of the people that's dying are Black people? You know, we come together and we our local delegation, as she mentioned, Representative Drummond, myself, Representative Clark, Senator Figgins, and Representative Jones, we met with the county health official, also the state health official, to get more testing kits in Mobile, because we know we are so behind on tests. We have more cases, more deaths than Jefferson County. We're behind. We did this in conjunction with Franklin Clinic so we could start providing free tests for people in our community. People need these tests and they don't have access. People feel intimidated when they go to some of these sites. They see these big signs, these 800 numbers, they see the police cars. They're like, man, I'm better off just going home and figuring this out on my own. People are intimidated. People are saying, do you have Blue Cross? Man, you know these people don't all have Blue Cross. We have to provide some type of relief for all citizens. This fighting this virus cannot be about the haves and the have-nots. We have to make sure that the people that have not have the opportunity to have these quality health care and service as well. And we've done that. But I just feel like people are not taking advantage of it. You know what? So some people, the numbers are okay. With the Pritchard site, it was like 23 people tested maybe on Monday, 25 on Tuesday. That is a site where it's free for the public. If they cannot afford to pay for it, if they have symptoms, they could call this number and they can go through this evaluation and they can go and get tested for free. They're also providing tests at Last Stadium. They are not turning people away at Last Stadium. Most of the people that we know in our community, when we got sick growing up, we went to the health department. Go to the health department and get tested. You know, when they start putting the rumors out there that it was $75 to $150 to get tested, it scared a lot of people away because a lot of people don't have that kind of money right now. But these are places that are testing and will provide this test for free. And it's better safe than sorry. We cannot wait until we can't breathe to go to the emergency room to try to get help, when help is right here and it's available. And like I said, Representative Drummond, she's been on the front line. We have made this available for our citizens, but we have to take advantage of it. You know, we complained in the beginning and said, we don't have testing. What are we going to do? We don't have testing. The tests are here. Now take advantage of them. And I'm sorry for getting passionate about it, but it makes me upset because I roll by some of these sites and I don't see the backlog. But my brother helped set up a free testing site in New Orleans. He's a vice president at Xavier, and I saw a line down the street. You know, those folks would drive from New Orleans to get tested over here for free. But we are not taking advantage of it. You know, like he talked about earlier, just us being more serious about it. We got to be more serious about this because this thing is attacking us more than anybody else in the whole country. And we're feeling the effect of it right here in Mobile.
Absolutely.
Can I just inject, if you can get your viewers the number for them to call, because you do not have to have insurance, as Representative Bracy said.
Absolutely.
But if you can call 251-410-6243. And all they need is your name and what are your symptoms. And they can set up an appointment not only at Ladd Stadium, but also at both locations on MLK of Franklin, as well as the Pritchard City Hall. And we understand today they're going to be setting up one in Saraland at the Walmarts, Representative Bracy, I believe. So there are locations.
It'll be in a couple of weeks, but yeah.
In a couple of weeks.
In a couple of weeks, but that one will be opening up.
And so there are facilities being set up all over the place. So we don't want anybody to be intimidated that they don't have insurance. I often tell my colleagues in Montgomery, most of the people that I represent don't have insurance. Yeah. That's why we're fighting so hard to get Medicaid expanded, because we know what poor people go through. but you do not have to have insurance. So if you would call that number, call the health department, they will schedule you an appointment and you can go and get tested.
Thank you.
And speaking from the health official, the state health, just one thing, speaking from the state health official, you just need one of these three symptoms. Either you've had a lingering cough that you can't get rid of, you have major breathing problems, or you have a fever or have had a fever. Those are the three things right there. Now, we already know about the people that's high risk, but if you have a lingering cough, a fever, or just gotten over a fever, or have major breathing problems, you can get tested. You just need to have one of those things and you can get tested.
And like Adito, well, Representative Drummond and also Representative Bracer has stated, please get tested. As you know, the city was one of the first on the first line. On the first line to get tests into Mobile County. On Tuesday at City Council meeting, the council also approved thousands of dollars more to get more tests here into the Mobile City and also Mobile County area. And I pledge to keep on trying to fight for the citizens, not only that I represent, but for every citizen, make sure that we can just get enough tests out there for everybody to get tests. I had made mention to the mayor a couple weeks ago that not only first responders need to be tested, but even the people that's in public works, because we know that most of the people in public works are African American. At least 90% of them are African Americans. And I told the mayor that my concern is that, one of them get affected from an outside source and bring it to the hub, and they affect some people there, and those people go home and affect their families. And he said that he did not really just, think of that. So now we are testing, the public workers and the sanitation workers. And it's very important, as they say, go and get tested, especially if you have one of the signs, the fever, the coughing. Because again, we don't want to go home and affect the children and grandmama, mother, wife, sister and brothers. The test is there. And we need, as far as the city council, we need to, approve more money to get more tests in. We're going to do it. We're going to do it till we can't do it no more. And that's my pledge to not only District 3, but to the city of Mobile.
Thank you very much.
Awesome. Well, I first want to give a huge thank you to all three of you for taking time out of your busy schedules, because I know those schedules are busy, but this is much needed. There's so much confusion. We just needed those on the front line to be able to put it into perspective for us. So thank you all so much for joining us for COVID.
Thank you for the opportunity.
Absolutely. And to our viewers, we want to thank each and every one of you for viewing Nspire U Network's COVID Conversations. Make sure you continue to follow us, like and share the Nspire U Network on Facebook, and subscribe to our YouTube channel as well. Before we go, I must say, everyone, please understand how important this is. Wear your mask. We have a lot of cute masks that people are wearing. Make sure they have filters, because if they don't, germs can go through the mask that requires filters. So make sure you have the right kind of mask. Wash your hands thoroughly. Yes, we've all been doing that, but wash them thoroughly under your nails, around your cuticles, because germs can linger there as well. Let's make great, smart decisions, because if your child or your elderly grandmother gets put in the hospital, you can't visit her. They're alone. So if you make the smart choice to be the person in the front of the family to say we all are going to protect ourselves, that could get this under control much sooner. So next time, we'll see you all. But until then, y'all stay safe, stay home if you have to, and just do the right things as we try to get hold on this pandemic. Thanks so much for you all tuning in.
Thank you. Bye.
Bye for having us.
Bye.